Hello friends, so today we are back with another topic and today we are going to talk about snoring. So snoring is not just a nuisance for the partner or the roommate, or it is not just a cause of sleep disturbance, but it has many deeper adverse effects and complications. So snoring could be an underlying symptom of what is called as sleep apnea or obstructive sleep apnea. So basically what happens is during the night time there is some amount of obstruction in the airway passage, which can be due to local issues or also sometimes the central pathways which control the breathing, that can be the cause. And as a result, the person has brief periods of apnea, which is or hypopnea, when the breathing is not good and resulting into microscopic or small amounts of sleep disturbances, and that occurs at multiple times during the sleep. So as a result, the sleep is fragmented, not continuous, and the person does not feel refreshed after getting up. And also, as a result, there is increased daytime sleepiness. So any person who has, say, unrefreshing sleep and more daytime sleepiness or feels tired should be screened for the sleep apnea or obstructive sleep apnea, also known as OSA. It is not uncommon because almost as per estimates 1 billion people in world they suffer from OSA. And if you look at the prevalence gender wise, males are more prone. So about say 25% of males can have sleep apnea as compared to 10% in women. So women have lesser. Also older people, sleep apnea is more common. As the age increases, the prevalence also increases. And other common risk factor we see is obesity or overweight. So definitely OSA or sleep apnea snoring is more common in those who are overweight also. Other risk factors to note are use of alcohol, those who smoke, use of sedatives or sleeping pills. All of these increase the risk of sleep apnea. And certain endocrine disorders, cardiac disorders also can increase. And not to forget the local problems in the nose, throat, the passage of ear, which can be easily screened by the ENT doctors. So these are all causes for sleep apnea. And then why do we care so much about sleep apnea? So it is not just the lack of quality sleep. It also increases the risk of various serious disorders like diabetes, hypertension, heart diseases like myocardial infarction or heart attacks, strokes, even the mental disorders like depression. They are more common in those with sleep apnea. So as you can see, many serious problems also can occur, and not to forget accidents. So those who are feeling sleepy in daytime or tired, they are prone to have accidents while driving. So these are all important risk factors that can occur just because of sleep apnea. So how do we diagnose? Symptoms can give enough clues. So the best is to do what is called a sleep study, nighttime sleep study, technically known as PSG or polysomnography. So the person has to sleep and the sleep is monitored for those 7 to 8 hours. And based on the findings, one can confirm sleep apnea. It can be mild, moderate or severe. And once we diagnose, what do we do? So as always, lifestyle modification is the first. So those who are overweight or obese, they should cut down the weight, which is with the help of diet control, means less carb and more exercises. And also the second thing is to make sure to avoid alcohol, quit smoking, and those who are taking sleeping pills or sedatives, discuss with the doctor whether you can stop or cut down the medication dose. And so these are some of the first things to do. Consult an ENT doctor to make sure there is no problem in the local airway passage, and a pulmonologist is also required to make sure there is no other lung issues that can complicate this sleep apnea further. And then other thing which has been found to helpful is, instead of sleeping supine, means flat, if one sleeps on the sides, then the sleep apnea symptoms can be reduced to a great extent. So that is something one can try definitely. And if these measures fail, there is something called as CPAP devices, which are quite popular and can help many people overcome sleep apnea. And in some refractory cases, surgery also is available. So just to summarize, if somebody snores, we should not ignore that. So snoring should not be ignored. Look for sleep apnea, and if it is found, get it treated initially by lifestyle modification, lying down on the sides, and then if doesn't work, then CPAP devices and ENT and pulmonology consultation are very, very useful. So I hope you have learned something new. Please like and share this video, post your comments and queries, and for more wider reach, for more similar informative videos, subscribe to my channel for watching more videos in the future. Thank you.